All right, everyone, welcome. My name is Meaghan Brown. My pronouns are she, her. I am a secretary on the Harm Reduction Nurses Association. We are here today, or I am here today on the traditional and unceded territories of the Lekwungen and WSÁNEĆ speaking peoples. Our mandate as an organization at the Harm Reduction Nurses Association is to advance harm reduction nursing through research, practice, and advocacy. We try to host webinars at least bi-monthly, and we've recently opened them up to the public. You can check out our website, www.hrna-aiirm.ca, if you'd like to become a member. And just before we get started on our panel today, I just would like to do an overall land acknowledgement. However, our panelists will also do each of their own respective land acknowledgements. So the HRNA does work with individuals and organizations across all of Turtle Island and would like to honor the life force of Indigenous peoples who have had their land stolen and who continue to resist ongoing genocide. Addressing the root causes of the toxic drug supply, of course, is deeply tied to decolonization. And we would also like to acknowledge the contributions and groundwork of people with lived and living experience in harm reduction. The content that we're discussing today and all the work that we do would not be possible without the without people with lived and living experience of drug use sharing their knowledge and experience with us. Without their generosity, vital life-saving harm reduction services and programs would not exist. Again, you can become a member at www.hrna-aiirm.ca. So today, we will be hearing from 4 nurses on the topic of health, justice, and social action in nursing. This comes from recognition often of, at least in the field of nursing, a lot of the education that we get is really around bedside or individual health services. Less often do we get more coverage until we really enter the field of how nurses can become involved in the areas of health justice and social action around political advocacy and policy. So we have 4 nurse experts who are quite involved in this work and have been over many years. I'm co-hosting today with the president of the Harm Reduction Nurses Association, Corey Ranger. So Corey, I think I'll pass it over to you for now to introduce yourself, and then we'll pass it over to our first panelist.
Thank you so much, Meaghan, and thank you everyone for joining us today. I'm really excited about this panel. My name is Corey Ranger, president of Harm Reduction Nurses Association. I use he, him pronouns, and today I'm joining you from the unceded Thole and Cowichan tribe territory. I'm just really excited to get us started, and I'm also doing some tech support behind the scenes and going to be primarily watching the chat. And so I'm going to pass it back over to Meaghan Brown.
Great, thanks, Corey. And I didn't mention, so we are recording today. So we'll have a recording that will ultimately be posted on our YouTube and shared on our social media as well as our website. We'll begin the panel with hearing from each of our panelists for about 10 minutes. Some have slides, some don't. And then we'll proceed to questions, about 3 to 4 questions that we've prepared before, and then we can open it up to the audience. Okay, for questions at the end. We do have time scheduled from 9 to 11 a.m. However, we may not end up going that long. Okay. So I will first pass it over. I think I'll pass it over to Marliss first. Marliss, take it away.
So, hello, everybody. I'm actually speaking to you from the land where I live, work, and play, which is Treaty 6 territory. It's the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, and Métis people. And we are all treaty people. We need to remember that. Is this strictly introductions, Meaghan, or just our land acknowledgements?
I think that we can just proceed with each panelist presenter, so you can kind
Okay.
of, yeah.
Okay. My apologies, everyone. I'm old. I'm always going to use that excuse. I have been working in harm reduction now for 28 years. And so a lot of what I'm going to talk about is just simply some general thoughts and lessons that I had over the years. And I think probably the first thing is when we're talking about social justice and advocacy, that we cannot do any of this without understanding the principle of nothing about us without us, that we have to have people who are directly involved, impacted, that are living the issue as the main speaker and centering them in the work that we do. I think that advocacy otherwise then just becomes about us. So having said that, so where the work that I'm in is around drugs, drug policy, and harm reduction. So having the voices of people who use substances is critical in the work that we do, but it's also more than that. We also hire people with lived experience or living experience, because we absolutely, on the team, just from a perspective, from the team perspective, you know, our crew that have lived experience bring a depth to the work that's so important. The other thing, though, that I do want to mention is that a number of the nurses that we work with have lived experience. And I think through our nursing education, we're taught in a way that we need to present a very perfect professional self. But in fact, many people have life experiences that actually will add to the passion of whatever advocacy it is that we're doing. So in our case, for example, I always do kind of a survey on our team, and it's an anonymous one, where I ask about, you know, different life experiences that people may have had. And, you know, without question, the nurses on our team certainly talk about the use of criminalized substances, domestic violence, pregnancy terminations, being exposed to different kinds of stigma and discrimination. All of those things, I think we shouldn't be hiding. We should be able to, if it's possible, if we're in a good place, to bring that at least into how we're going to be doing our advocacy, so that that's a really important piece of it. I think another good piece of, or another important piece around advocacy is really talking about what information do we have and what's valid information. We've certainly seen, especially through COVID, how misinformation and disinformation, sometimes intentional, muddies the waters, and people, you know, will pick up different pieces of something they heard, something that was on the news. You know, we see that all the time when it comes to drug policy. I cannot count the number of drugs that have been connected to zombies, and I don't understand why, and it makes no sense to me, and I'm pretty sure there are no such things as zombies, but for some reason, you know, it keeps coming up through the media. But I think we need to at least be really aware of what's going on in the general public, and to know that those kinds of stories and bits of misinformation are out there. But we also need to have, you know, the evidence, if there is any, for what it is that we're doing, having the data, being up to date on what's going on from a political perspective, because, you know, I'm from Alberta. Treaty 6 territory is also known as Edmonton. And so I would say that politics have played a huge role in how we can do advocacy, and particularly around drugs and drug policy. So you need to really have your finger on the pulse of what's going on in the world and understanding what is wrong and what's right. And, you know, some of our work, certainly when it comes to drug policy, you know, happens in very public spaces. It happens in our workplace. Sometimes it happens around the Thanksgiving dinner table because Uncle Bob is there and he's shooting off his mouth about something that doesn't make sense, or that's offensive. And so I find, especially in drug policy, you're constantly trying to do advocacy, both, well, not both, but at an individual level, at a systems level, at a government level, at a general public level. So it's always good to have those, have the information that you can present to people. I also think sometimes nurses, I find, have a little bit of snobbery in that, gosh, we know it all. We know everything there is to know about health, which of course isn't true. We know a very small part about people's lives, hence the importance of having, people with lived experience as a part of this. I guess the other thing that I would say, that advocacy is exhausting. It's heartbreaking sometimes, especially as you're fighting for something that is just so incredibly important. We see people dying of drug poisonings here all the time. And they're people, because in harm reduction, it's about relationship and developing those friendships with people. It tears your guts out all the time. And so it is exhausting. So another big piece, I think, around advocacy is finding allies. And the allies can be other nurses. And if not other nurses, then others. But I think often, at least what I hear a lot from new nurses, is that they go into a system where there's already a mindset and a tone, and it's very hard to try and change that. But it's figuring out where are your allies and where are the little things that you can do, that you can expand on to kind of actually spur on a bit of a movement. I think all nurses want to do the best they can for every patient that we see, every client. But in order to do that, we can't just singularly be doing that. I think we need to find a small army that gets bigger and bigger and bigger, and then support each other in doing that. So I think at this point, I'm just going to stop there, Meaghan, and let others share their wisdom.
Wonderful. Thanks, Marliss. I really appreciated you bringing up the point of that nurses can also be people with lived experience. I think that's something that we don't talk about often enough, and very relevant actually to the recent BCNU. I'm not sure if people have heard of this, but recently the BC Nurses Union has passed 3 resolutions relevant to supporting nurses who use substances according to harm reduction. So a topic that maybe we can discuss later on when we open up the panel discussion. Okay, so I will pass it over to Michelle Danda. If Michelle, you want to do a bit of an intro and comment related to your work.
Yeah, hello. Thank you for inviting me to this. So good to see everyone joining today. I'd first like to acknowledge that I am on the traditional and unceded territory of the Coast Salish peoples, and this includes Kakite, Musqueam, Squamish, and Tsleil-Waututh nations. So that is also known as, I'm in the Lower Mainland BC. I live in Vancouver area. And I'm gonna tell you a bit about myself. I'm gonna contextualize it a bit so you have some understanding of who I am and where I'm coming from when we open it up for questions later. So I am originally from Calgary, and I graduated from nursing at the University of Calgary in 2008. I did the accelerated track program there, and before I did nursing, I was a youth worker. So I worked with youth in group homes. And pretty much as soon as I started nursing, I knew that Calgary and Alberta didn't really, the values and what was going on in healthcare didn't really align with my values. So I moved to Vancouver like the day that I finished my clinical, and started working in concurrent disorders on an inpatient unit. And for those of you that don't know, concurrent disorder is the combination of mental health and substance use. So I started doing that on an inpatient unit in Vancouver at UBC Hospital. And back then, like in 2008, this was a pretty new thing. Like the idea that nurses on an inpatient mental health unit were also treating patients for substance use. That was like a new innovative unit that was opening. So I was really happy to be working there. It wasn't really all that I envisioned it would be. So I've worked a lot of different places. Since then, I've worked at Vancouver Detox. I've worked at other inpatient concurrent disorder units for adults. I've worked with adolescents. I've worked for a sort of community treatment team. I've worked as a nursing instructor for the UBC School of Nursing. And recently I did kind of a switch. I started working in clinical informatics, which is like the clinical documentation and electronic systems that nurses work with. And then in October, I went back to kind of more aligned with direct care nursing and professional practice. So right now I do professional practice in Vancouver community in mental health and substance use. And that includes places like Insight, Vancouver Detox, Intensive Housing Outreach Team, all the mental health teams that are out here. Yeah, and I continue to do work, practice-focused work with inpatient, acute inpatient mental health as well. Yeah, and in the last 3 years, kind of since COVID hit, I kind of felt a little bit disconnected from nursing because I was working in informatics and working from home a lot. So I started volunteering in nursing associations for nursing and for nursing organizations, which is how I ended up being the Western representative of the Harm Reduction Nurses Association. And I'm also on the membership and communications committee for the Canadian Federation of Mental Health Nurses. And recently I started doing some work for the BC History of Nursing Society because I'm really interested in history of nursing as well. So much so that I started doing a PhD in nursing, and my focus is on education of psychiatric nurses in BC. Yeah, so a lot of my work for the last 15 years has been in the area of mental health and substance use. And I wish I could say that it's changed a lot since 2008 and that we've made a lot of progress. And in some ways we have, but in a lot of ways it's still the same. So I'm really, like, a lot of my advocacy work and activism work is in combating coercive practice and also trying to get education and teaching for nurses about harm reduction and substance use in inpatient mental health areas. Because a lot of the care that we do, it's based on paternalistic kind of practices that are traditionally based. So a lot of my focus and energy is on trying to change that. And it's often, it's an uphill battle. It's been an uphill battle for the last 15 years, and there's, a few steps forward, and then it seems like a few steps back. And I think that's one of my biggest lessons in advocacy and social justice and trying to make change in nursing, because it's not a constant uphill progressive battle. Like, I'll think that some things are changing, and then it turns out there's a lot of roadblocks. So it's a slow process. And it's something that, like Marliss said, it's really important to find allies and to find that group of people that, have thinking aligned with your thinking, so that you can have that energy and you can have that cohort to try to get ready for these battles. Because sometimes these are like little challenges and battles that you have to face. So that's another important lesson, is to know when to pick your battles. Because there's a lot of problems in the healthcare system across the board. I think we all know that. But it can really be disconcerting and disillusioning if you constantly are focused on everything wrong. So it's like important to pick your battles and kind of find your allies and celebrate those small wins and any progress that's being made. And I think I will leave it there and let the next person speak.
Thanks so much, Michelle. I really appreciate you sharing the importance of finding allies, because it can be hard sometimes, even though it feels like sometimes we're in a pretty supportive environment because we have these networks. So we feel that there are other people in the healthcare system who have our backs and who are like-minded. It can definitely burn you out when you realize that speaking up in your practice can, result in a lot of lateral violence at times. So, okay. All right. So next, I think I'll pass it over to Meaghan. Thank you so much, Meaghan.
Great. Can you see my screen? Is it working? My screen share is going to the next.
Yep, it's great. It's working.
Thanks. Nice to see everybody here and see some familiar names and colleagues in the audience as well. Want to acknowledge that I'm also in the traditional territories and unceded ancestral homelands of the Squamish, Musqueam, and Tsleil-Waututh Nation. So in East Van, also known as, and I'm really bad at talking with slides. I threw in a couple of pictures, but I thought it might be interesting to share a bit about my personal path to sort of social justice work in nursing and my kind of personal activist journey. And then just I had, I think, 3 or 4 ways that I sort of enact my work that I thought I would pass along. And like probably many of you, my work in overdose and particularly and in harm reduction comes from my lived experience. So was in intergenerational trauma in my family, or from I'm a first generation Canadian and my family's from Ireland and Scotland, so a settler here, but also had that experience of being an immigrant family and lots of the things that come with, you all know the history of Ireland that comes with that, and probably had undiagnosed ADHD as a young person and had a very early, now I read the journal articles and I'm like, oh, that was me, very early exposure to stimulant use and psychedelics when I was, I think, 14. And so had a lot of substance use in my life and was a peer actually at a needle and syringe program. And that was all before nursing. So I came into nursing a little bit later in life, knowing that I wanted to work in really in harm reduction and in drug policy. My friends were dying, and it was also around the time of the AIDS epidemic. And so lost 2 teachers to AIDS when I was quite young. And that, I think, one of the great lessons of the HIV pandemic, which was sometimes people forget was a declared global pandemic, is just, I think, the system, those of us who worked in healthcare learned that it really doesn't work, and we can't support people to succeed on treatment like antiretrovirals without really respecting nothing about us without us, that Marliss talked about in the beginning. And you can't achieve anything in HIV unless you engage with people with lived experience. And so it's really, I think, been a great training ground for future work I've done in more global health settings. And I don't even know how I got into working on Ebola responses and international health, but I use those lessons from early gay men and people who use drugs that taught me how to deliver healthcare. And I worked on 10C, the HIV ward was my first job at St. Paul's, along with the BCCDC street nurse team. And I see Caroline on here, also taught me everything I know. But working combination of acute care and street outreach was my first nursing job. And that was such a gift because I wasn't stuck in the hospital all the time. So I knew when I was on the street how hard it was for people to get access to the system, but I also knew how hard it was to make changes from the inside. And so that those were really foundational experiences in my nursing career, and the Stop HIV/AIDS project, which was somewhat controversial, but was really looking to transform HIV care in the province. And that's where I kind of learned my bigger policy objectives. And then on the side is my son, and I think that's also been my greatest teacher. I had him when I was quite young. I was 19, and I often say he saved my life. And I think he was just came at just the right time for me to kind of interrupt my probably substance use journey. And so for me, it's very personal, particularly when I decided to do my PhD, it was around substance use in women and women who use drugs during pregnancy and overdose prevention. And that my work at Sheway as well, which was very foundational in my nursing journey. And that's very personal to me, like the stigma that women who use drugs during pregnancy experience. I experienced it, and I had obviously the white privilege, it's the white supremacist, racist healthcare system that we have. And I know if I didn't have those privileges that he would have been removed. And so I'm very conscious of like that, what could have happened to me had I gone down that other journey. And this is just kind of an image of some of the amazing activists that I get to work with in my global health career. So I often like to situate working in my own communities and then working and sharing and learning together with colleagues internationally. And that's been some of the greatest gifts, just also see the similarities of our activism. And these are some people with lived experience and nurses and activists in Cameroon. And it's just such a joy to meet with them and hear their struggles with harm reduction, and their struggles are the same as ours. And that's been really wonderful. So maybe want to get to our next speaker, but I'll just share maybe 4 ways that I try to, 4 tools that I wanted to share with folks, how I enact my activism. And there's really 4, I think: research, my leadership, policy change, and then my clinical practice. And so this is just an example of really the only main paper I published from my PhD on the impact of child custody loss on overdose, and learned from colleagues at the Center for Gender and Sexual Health, where I did my PhD, that it's not enough to just put it into journals. We need to have things like this. Like, so this is one of our knowledge translation products about the impact of child custody loss. And one of the greatest lessons I got from this work was working with my mentor, Sophie Pierre, who's an incredible Indigenous leader. And we made the very intentional choice, and I was mentored to do this, and I'm grateful to Dr. Kate Shannon for this, that as a settler, it's not appropriate for me to talk about my research in media without Indigenous leaders with me. And that, so Sophie did really every interview that we did them together, and she was able to speak from her experience as a grandmother, as a really important elder in her community, and what child custody loss meant to the community, but also from a place of strength. And so that was really important teaching to pass on. The second area is just kind of working around in policy work and some of the challenges we had during COVID. I was lucky to work as for the big public health authority here in Vancouver as one of their COVID-19 leads for the youth and vulnerable populations at the time, and now priority populations. And was really proud to have been involved with some of you on the pandemic prescribing initiative. So we were able to sort of open the crack a little bit on safe supply in the early days of COVID, and use those opportunities of the pandemic to hopefully get safe supply for people that then turned into better guidelines in the future. And then the third area is really just, again, in this policy space, was happy to be able to co-author this Improving the Health and Rights of Pregnant Women Who Use Drugs group with the Soros Foundation. And so again, this is an international policy document, and like as a nurse, being able to spend that time to write these things, they're not journals, they don't count in academia really, but these guidebooks I found can have really big impact. And then the final area really is our clinical practice. I do think as nurses, we just have such an immense privilege to be shoulder to shoulder with people and these moments of their lives. And, you know, reflecting back, if I had a time machine on the way I did my research for my PhD, I would say it was more deficit based. And I love this saying, this comes from the Portland Hotel Society's slide deck, where I was lucky to work at Insight and work with that team there for a long time. And that this was a term that Andy taught me about people, not pathology, and just really thinking through how everything we can do can be about the strength and the lived experience of people, and our ability to sort of, in my example, partnering with families so they can stay together with their loved ones. And then I think our community of nurses and the community of people that we work with as harm reductionists is so powerful, and that there's so much we can share. And so I think our clinical practice is huge. I'm a big fan of nurse leaders trying to still see clients, and it's something I fight for in every job I have. I don't understand why we have to fight for it. It drives me absolutely crazy that physician leaders can, be medical directors and still, see clients, and that often as nurses, when we get into leadership, there's this expectation that we can't continue to do frontline practice. And so just that's, I think, my other big tip as you as people evolve into their activist careers. And then this is that little baby, all grown up now. But, you know, to me, this work is personal. It is deeply relevant to my family and to my community. And I'm really thrilled to have been able to sort of raise feminist sons and to be able to parent them. And that's not the experience of all of the women I work with. And I want to stay in this activist journey for them and for all of us. Thank you.
That was amazing, Meaghan. Thank you so much. We're getting some love in the chat for people, not pathology, dignity and personhood, not diagnosis, from Louise. I'm really happy to introduce our next speaker. We had some technical difficulties and lots of behind the scenes sweating and sending registration links, but we got it figured out. And I'm really excited to introduce Birgit Umaigba. Birgit is an expert registered nurse, a change agent, thought leader, public speaker, nurse consultant, and health equity activist. She currently teaches adaptive leadership at the Graduate Science Education Cummings School of Medicine in Calgary. Also, she's a clinical instructor at Centennial College's School of Nursing, where she teaches nursing students in both the collaborative and bridging programs. Birgit is a fierce advocate for social justice, anti-racist healthcare and education, nurse wages increase, improvements to labor conditions, and the increased employment of internationally educated healthcare nurses across Canada. Her advocacy and scholarship have focused on promoting a healthcare system where Black, Indigenous, and racialized people are represented in leadership positions. She has published opinion pieces in these areas and related subjects in media outlets, both nationally and internationally. She regularly serves as a nurse consultant and keynote speaker for a variety of audiences in healthcare, women's equity, anti-racism, and immigration. She recently spoke as a guest speaker at the 2022 Martin Luther King Global Summit. Thank you so much, Birgit, and I'm going to mute myself and then advance your slides. So I'm going to share my screen while you get started.
Thank you very much. Thanks, everyone. We had a lot of behind the scenes, like you said. I'm currently using my phone as a result of that. So bear with me. I'm glad I have, my profile picture there so you can see me. I just want to start. I just want to start by thanking the speakers who have spoken before me and great insights, great wisdom, and very passionate work. I acknowledge that Durham region forms a part of the traditional and treaty territory of the Mississaugas of Scoville Island First Nation, the Mississauga people, and the treaty territory of the Chippewa of Georgina Island First Nation. And as a Black woman who experiences anti-Black racism on the stolen land, I acknowledge that my liberation is bound with Indigenous sovereignty. I really like to start every conversation or discussion with my positionality, because I do think it's really important how we navigate the world in this work. I'm Benin, Nigerian, Canadian, Pan-African, and Black by identity, politics, and power. I navigate the world as a Black, cis-able-bodied Christian mother and wife. My critical approach to nursing, healthcare, and activism is Afrocentric. I step into the nursing profession and healthcare as a Black woman, and as such, it is my life's goal to challenge every form of anti-Blackness within my profession. I aim to create an awareness on how racism affects Black, Indigenous, and racialized peoples, with a mission to dismantle it in all its forms. I often say that I'm not going to sit at any table to be the checkbox, just for one institution to applaud itself on including a Black person. I've had experiences in the past where I've been tokenized. And I think anyone who's ever been in that space would agree with me that is one of the worst feelings ever. We say representation matters because historically, people like me have been excluded and continue to be excluded. So far in my career, I've managed to create my own table through finding my voice in advocacy work. I really like this quote by Curtis Scott King. Says, it doesn't matter how strong your opinions are. If you do not use your power for positive change, you're indeed a part of the problem. I'd like to skip the slide on what advocacy means, because my peers here have actually spoken so much on advocacy. but I just wanted to ask this question: does advocacy belong in nursing? So I want us to pause and sit with it a little bit. I know we've heard the previous speakers, but to you listening, do you think advocacy belongs in nursing? So while I'm constantly trying to answer this question, even though I know the answer, but I keep asking myself because of the consequences of advocating and the repercussions for those who advocate. And then in doing so, I do some research and try to find out what supports are available in terms of nursing organizations and associations. So I looked up and saw that there's considerable inconsistencies across national codes of nursing practice, and there's so much confusion amongst nurses about the meaning of the term and expectations concerning professional roles. According to the International Council of Nurses, the term advocacy actually appears only once in the ICN Code of Ethics for Nurses, and the statement advocacy for safe and healthy environment appears as the 15th item out of 42. The code attributes this responsibility to the professional associations rather than to the practice of individual nurses. So let's think about that for a moment. And then if we proceed, I looked through the Canadian Nurses Association and just to see what they had to say. And the CNA says that advocacy involves engaging others, exercising your voice, and mobilizing evidence to influence policy and practice. It means speaking out against inequity and inequality, which involves participating directly or indirectly in political processes and acknowledging the importance of evidence, power, and politics in advancing policy options. As an individual nurse, I've tried to live these definitions, but they really do come with a lot of consequences. And I went on to see what the College of Nurses of Ontario had to say about advocacy, and it was more or less, what nurses who advocate are supposed to be doing. So nurses advocate for patients and help them access appropriate health care. Nurses advocate for improving the quality of their practice settings to support safe practice. And then if you look on the slide here, the CNO sort of calls nurses who advocate leaders, and all nurses are leaders at the same time. So meaning that in a way, all nurses should be advocates for patients and for healthcare and for social justice. So my question again is, what does advocacy mean to you? Right? For me, I've had the privilege to work as a clinical educator as well as a practicing nurse. I still practice at the bedside, and I float around different hospitals. I think the drive to be more vocal publicly actually came about during COVID, traveling around different hospitals and seeing how different hospitals had different sort of supports in terms of equipment and the type of care that patients received based on demographics. It was really eye-opening for me, and this systemic inequities were just so glaring, and the systemic racism within the healthcare system was literally, you could see like palpable right in my face. And I'm like, how do I go about talking about this and without getting into trouble and challenging structural racism, speaking out to protect these patients, and seeing how the Black community was so disproportionately impacted by COVID-19. And we all know that the COVID-19 pandemic laid bare existing inequities. They didn't just happen. They've always been there. So for me, advocacy is more or less the courage to rock the boat a little, despite the consequences. For me, it is calling for equal representation of Black, Indigenous, and racialized nurses in nursing, healthcare, and leadership positions. This could mean asking why there are no other groups represented at your table. I see a lot of organizations trying to, act equity. They're trying to perform equity, but the solutions are there. Like, you just need people at those top positions. You need to engage with the people that are not at your table. You need to get them involved. We're talking about nothing about us without us. How do we bring about a change without including the people that we're trying to advocate for? We should be advocating with people. So again, what does advocacy mean to you, and how far are you willing to go to be in solidarity with other marginalized groups in the society? And I really like this quote by a New Zealand Maori nurse, which says, there are three kinds of people: those who make things happen, those who watch things happen, and those who never know what hit them. Let nurses be in the first category. This is interesting because as a practicing nurse, I actually, I get to see and talk with nurses, and a lot of the issues are discussed, at the nursing station, in the lounge, and it just ends there because nurses are overworked to the point that we're not even trying to engage with the social issues, trying to pick up a paper to read about what's happening, and that is how we continue to be, taken advantage of. So it's just so obvious how the system is structured in a way to make nurses so overworked and tired that we're not even able to engage in advocacy work. So I do hope that this quote reminds us, and we're able to ask ourselves what our roles are in terms of advocacy and how we can challenge systemic inequities. Thank you very much.
Thank you so much, Birgit. I really appreciate so many of the points that you made, and I really appreciate you asking us to think critically about what does advocacy mean actually for nursing, and what does it actually look like, and the distinction between advocating with people versus advocating for people. And I think so far already, obviously, I don't think it's a surprise. Everyone has spoken in some way about the importance of the principle of nothing about us without us, as well as your comment around doing this work often comes with a lot of consequences. And I think it's important to ask nursing, like how are nurses actually supported to do this work? If we have it in the CNA Code of Ethics, how are we actually in our practice supported to actually do that? I personally don't really see how that happens. Anyways, I'm kind of going off script now, but yeah.
Thank you so much for that.
Oh, thank you.
Yeah.
Okay, so I'm just going to share my screen here, and then we'll get started with our questions. So we'll probably have about half an hour to 40 minutes of that, and then we can open it up to the audience. Just give me a second here. Okay. All right, so for the panelists, so what would you say is the strongest or most effective tool for you in health justice work?
I could go.
Thanks.
For me personally, it's been storytelling, sharing stories, and it's interesting how that could be a challenge because we have to uphold, the principles of, the standards of privacy and confidentiality, and being so mindful of how we share stories, so we're not sharing patients' personal information. So I think storytelling has allowed me to pretty much expose the working conditions of nurses in a way that is putting the patients at the center of the work, and while also inviting the public into that conversation to be able to see and have, kind of imagine what it must feel like to be a nurse, and ways they can participate in advocating for better working conditions, equitable pay, and more support for nurses. Other tools that have allowed me to continue this work is actually, networking and building relationships with nurses as well as other advocates, networking and supporting grassroots organizations that are actually working on causes that are focused on equity and social justice issues. I currently volunteer with the Decent Work and Health Network, which is a grassroots organization that's focused on highlighting the working conditions for all health workers, as well as also advocating for the regularization of undocumented migrants. And there's so much more that that we do. So I think getting connected with such organizations allows me to stay informed, actually allows me to remain accountable to the work, because even sometimes I'm feeling tired because advocacy work is tiring, and oftentimes you get discouraged, especially when the repercussions are coming from those within your profession. And I find strength in working with these organizations that allow me to think about the bigger picture and think about who's getting that extra support as a result of the work. And having the knowledge and expertise is a tool as well, staying informed, knowledgeable about the issues that are affecting people. So deepening my advocacy work through evidence-based information, that statistics and backing information output data actually allows me to be a trusted voice. And of course, strong communication skills as well.
I think one of the things for me is Birgit, you just put it so beautifully. Part of that is about having the knowledge and the evidence. So I'll give an example. In Alberta, if you are pregnant and without a home or a house, you cannot get social assistance until your third trimester, unless you have a doctor's note, and many physicians will say that no, she should go to work. Like, it is absolutely ridiculous. But understanding sort of what the regulations say and being able to explain them with passion and authenticity can really make a difference. And even just asking the question back. So do you think that someone who's in a soup line and living in a dumpster is going to be able to have the healthy baby that you seem to care the most about? That always, being able to be authentic and to be real. And I know, even when we were trying to get supervised consumption going in Edmonton, being with the media, but being able to speak authentically about how bad things are, or how sad or how tragic it is that a group of people are being so badly treated by the systems, and that there's a better way. It seemed to really make a difference. So.
Absolutely. Thank you for that.
Yeah, I mean, I could just add, I think both summarized it so beautifully, but I want to give another exclamation point on relationships, which is something you mentioned, Birgit, and whether it's relationships with media or politicians or other activists or other nurses, I think that's actually what's made anything I've done quietly, like, that's what's had the biggest policy impact. And understanding your role in the ecosystem, I think a lot of us experience being silenced by our employers, and it's one of the barriers to nurse activism, and particular because we're told, like, no, if someone asks you to speak, you need to refer them to communications. And so finding ways that you can talk to media maybe without your employer's hat. And so again, being part of groups like Hrna, where you can say, well, yes, I can take this media call, but I'm just going to represent myself as Hrna, or I'm going to represent myself with my academic affiliations. Even for this talk today, I'm using my UBC affiliations, and that's intentional, because then I'm not representing the public, government funded body. So understanding the sort of workarounds for that silencing that we experience, and then just also understanding your role in the kind of activist ecosystem. And so I come from like punk activism, like protest movement, I've had the crazy experiences now. I've been sitting across from leaders that I like used to wear a t-shirt with their face on and that had swear words all over it. And now I'm like, I can't believe I'm having dinner with this person. But over time, I've learned that, like, you can get so much more done when you talk to people on the other side of the aisle, and that, depending on what your role is, and I have colleagues who are full-time academics and they can be much more critical of government, but I work for government. So, but I know and can sort of help activate some of those folks who have different roles in the ecosystem. And I think that's so important that we respect that of each other and know that some of us are being more vocal at some times than others, and that there's a reason often, but that we all have a really important role to play in that ecosystem. Thanks.
I really appreciate that, Meaghan, because that's exactly what I'm working on about myself currently, and trying to see how to, build the bridges with the opposition, really. And just like you mentioned, and it's so important because at the start of the work, it's more like us versus them. But in the end, we just need to find ways to work together and know that we are all in this together. And sometimes most people are actually tied and they want to do what is right, but we just have to find ways to work together. And I think that is what is very difficult, especially on certain topics like, racism. And you're finding that there's so much systemic racism. And when you're trying to talk about it, most people are taking it as, we're fighting them, the individual, as opposed to the system. So it can be very challenging. It takes a lot of, emotional intelligence. It takes a lot of resilience and persistence, really, because the discouragements do come, and you really do get the repercussions. I'm speaking from experience, and yes, we just need to find ways to work together. Thanks for that. Appreciate it.
And I wanted to add as well, like, something that I've learned is that, like, it can feel lonely doing this work, but it's also important to know, like, be informed on the landscape and the context of what's going on and what all the other organizations are that might be doing the same work, because there's strength in numbers as well.
Yeah.
So it's important to, like, understand who else might be doing the same thing, who can you link up with to strengthen your position of advocacy. Because I find sometimes, especially in Vancouver area, like, there's a lot of duplication of work and duplication of services, and I'll be working on something and then I'll find out that, like, oh, this organization is doing the exact same thing, and we didn't really, like, do that environmental scan first to find out who else is doing this work. So I think that's a really important thing to understand as well, to, like, make those links with those different organizations that are like-minded and find out what the landscape is of the work that's being done. And also, like, I think it's really important to know when and where and how to use your energy, and where, like, where the best use of your energy is at a certain point in time. Because, like, sometimes I'll read things in the news and I'll get so angry and I'll be like, I am going to write an op-ed, and I'm, get so focused on, like, I'm going to write all these op-eds and it's going to be in media and it's going to change everything. But sometimes it takes a lot of energy and it's not the best use of my time. And that's draining. Like, all of us have acknowledged already that this work has been draining. So really knowing where and when and how to focus your energies, so you're not just constantly working on something and getting drained all the time, because in the end you'll get burnt out and you'll end up quitting. So yeah, that's what I'll have to say about that.
Thank you, everyone. Everyone said so many great things. I really appreciate so many of these practical suggestions as well. Even Meaghan, just what you mentioned around, if you're speaking to media, saying that you're a Hrna member, being strategic in how you affiliate yourself, because there are so many anti-whistleblowing policies for nurses that it's wild. I mean, even in my own experience, really the only way I've ever really been able to be involved publicly is through my affiliation as a grad student. And then all of my colleagues who are actually frontline are absolutely terrified of speaking to media or putting anything on social media, and it's really such a shame. So next question for our panel. We also have lots lined up in the chat, so thank you so much, everyone. Corey is keeping track of those. So I think we've already spoken, or folks have already spoken to some of this here, but what are some of the major barriers that you think are barriers to nursing involvement in direct action? How do we overcome these barriers as nurses? So you've already spoken to some of those, but if you have anything to add.
Well, I think we might just go in the same order again. Just like, Ro mentioned, it's just a fear of repercussions, which we've highlighted, disciplinary actions, and some of us have actually spoken to how to navigate through that. I think another major barrier is the lack of awareness of, or knowledge of social justice issues, the things that are happening. And again, it's because of the professional obligations and time constraints, nurses being overworked, not having the time. Like really, when I work day, night, after those 48 hours of work, I just wanted to sleep and lay in my bed. Like I didn't want to talk to nobody. I didn't want to read anything because it was just so physically exhausting. The first 2 days I was recovering, and then the third day you have housework and, you have a life too. So I think the way we work, the nursing work schedule is just around a lifestyle that doesn't allow you to engage with meaningfully with politics or advocacy. And that is a big challenge. I think we really have to go out of our way to be able to participate in advocacy. The bigger pictures, however, there's also little ways people can get involved, like signing petitions, just, signing up with a local organization that you're passionate about, and then just getting those messages and trying to, scan through those on your breaks if you're really passionate about it. I've done that. I remember being a nursing student and being involved with the RNAO and just staying in the loop with information that way, and getting involved with your call to actions and take your MPP to work day. Like I was, that's how I started. Like you have to really stay informed of the information. And again, another barrier is the organizational restrictions, right? And being aware of your organization's policies on that is really important. I remember the one time after being so vocal, like now I'm like quite vocal and all that, and getting a full-time job where I was called into the office, not even within a week, to change my email signature and remove the advocacy piece and stuff like that. And because it wasn't a part of the organization's policy for me to present myself that way. So I think that's important, navigating through that by, building community alliances through other organizations that can support you, having that hat on. If you're working with the HRNA, or most times when I do interviews, I present myself as a health equity contributor with the Decent Work and Health Network. And and engaging in self-care. Rest is resistance, and we really have to think about this work, that it's always been here. A lot of people have come before us and they have done this work, and they've gone. And here we are now. So, and the work is still going to continue with or without us. So we just have to prioritize our self-care so we can refuel, and hopefully we're able to continue the work.
I think what I would add to that, because those are all such excellent points, but I think one of the things that we haven't done well is to talk about what is advocacy and how do you do advocacy at the level of just nursing education, at the basic level. I just feel like there's so much more that we could be doing about that. I loved, Birgit, when you put on your slides, what are some of the global concepts around advocacy, which are pretty small, but that we need to be doing better with that. I also think there's a lot of fear, and some of it is fear of consequences, of course. Some of it is fear of being seen as being different. I think sometimes, we in our harm reduction world, we come across fear all the time where people are afraid of the folks that we hang out with or that we work with. And so just being able to move past the fear makes a big difference. I'm lucky. I'm old. I've been around forever. No one's going to get rid of me at this point if I say something. However, I am in a province where harm reduction has been spoken of by the provincial government in very negative terms. And so some of that is dealing with my own hesitation and fear, but also trying to step out and trying to do what I can in big and small ways. So.
Great. Do the same order. I mean, again, we've spoken at length about, media as a tool of advocacy, and I think I loved your point about fear. Again, it's not true that we're not allowed to speak to media. It's just that we're not allowed to represent our organization. So, I've given you my hot tip on how to do that. But the other hot tip I'd have is preparing yourself. And I'm super happy to chat with people afterwards. But if you haven't taken media training, I would strongly recommend that, because it just helps demystify preparing yourself and getting your key messages straight. And the frame that I've learned most of my kind of activism skill set and that toolkit through working in politics. And I mean, another challenge for us is that, especially when you're in government, and if you want to be able to, as governments change, you really have to publicly at least be nonpartisan. And so I would say there's media, but there's also a lot you can do in the back room. And that kind of alludes to what I was talking about earlier and understanding my role in the ecosystem. I've over years realized, like, you can, if you maintain good relationships with different people in the policy space, and it's not necessarily always politicians, it's also like the deputy minister is often more powerful than the minister, and understanding, who are the central people in government are, and, if they have a question, being able to answer it and to build those relationships with them. And so I think the media work is more visible than the back room. But one of my mentors, Jim Green, had a quote. I think it's certainly not his, but it's maybe a Roosevelt quote or something. But you could do anything you want as long as you don't care who takes credit for it. And that's just one of my favorite. Like, there's so many things, like, to really have an impact as an activist, you have to be happy to, like, build people up and let other people sort of tell stories. And sometimes my voice, again, a settler, like, nobody needs to see me. We need other people in the media now, and more frontline engagement. And I'm really happy to help any of you. If you haven't done an interview, share the tools and tips that we've done, because we need, especially all the young nurses, to get out there and be that voice for harm reduction.
Meaghan, can I add something on to what you said? And I'm sorry, Michelle, I don't mean to jump in, but then when you do media stuff, don't read the comment section. People can be brutal these days, and it can just eat you up, but just don't do it.
That's so true. I second that.
Yeah, like, I think everything is so much more public now than it used to be. Like, even when I started my career. So yeah, don't read the comment section. That's good advice. Something I wanted to add was, like, I think sometimes when we're student nurses and when we're staff nurses, sometimes we don't know how to get involved in advocacy, or like what is within our power, what are, like, who do we ask, how do we get involved? So I think it's important to find mentors, and also to join organizations like, I don't want people to think this is a plug, but places like Hrna, or there's many different nursing associations that do a lot of advocacy work. And that's a good way to kind of get connected and find out what's going on and find like-minded nurses, and kind of get your foot in the door, and to start getting a taste of what kind of social advocacy and activism is being done. And you know, it's really important that we find those mentors, or that we talk to more experienced nurses and people in these organizations to find out how is it that we do advocacy, because Marliss is right, it's not something that is taught in undergraduate programs, unfortunately. So yeah, like I think it's important to get involved, even as a staff nurse and as a student nurse.
Thank you for that. I just wanted to add, sorry if you don't mind. I think even within your, if you work for a specific organization, like what has worked for me is, I don't like, you know, my college actually supports my work. But there was a time where I was I was mostly talking about B124, and this particular organization that I worked for actually supported what I was talking about, right? Because it was more broad, and I was speaking for all nurses. So I felt that support. They actually even gave me the kind of the chief nurse executive's office to use for one of my interviews and stuff like that. So it depends on what you're speaking on, and then sometimes you may have that support from your organization, and they actually want you to use your name as a way of, you know, promoting them as well, because they're kind of proud to have you as a part of them. So knowing how to balance that is important. But, you know, everyone has actually said very relevant points.
Thanks, everyone. It's an important reminder for me to do media things. I still have not. I've had some bad interviews myself, so thanks. All right, just quickly here, that's not letting me advance. Okay, so one of the main reasons that we have hosted this panel is because we get so many questions, and I had the same question myself as a new grad nurse of how do I actually do this work? How do I actually get involved? It can seem like a really big task. So if you could give your new grad self some advice related to health justice work, what would it be, or what's the most fundamental lesson you've learned? If you could think back to when you first started.
Yeah, for me, it was, again, it's part of, it's going back to the fundamentals, which is networking, building those systems of network and coalitions where you can actually see people who are doing the work and learn from them. You know, it just sometimes it's just literally observing. I remember there was a particular leader that I really admired, you know, his work. And I went on the internet, I looked through the credentials. I'm like, how do I get here? How do I get here? You know, and just being inquisitive and embracing lifelong learning has actually enabled me, you know, to walk this path. And just practical things that I did, which was, as a student, was very, you know, hard to commit to, because you have your school assignments, you have exams and all that. But I would always create that time if there was the particular organization that I was a part of. I created the time to engage. Like if they had you know, a protest or a rally, I would find time to read about it and actually present myself there. And that's how I built network. And that's why I got involved and try to, you know, find my own passion and voice. And some of these organizations will prepare you. For example, any of the grassroots organizations that you may want to join, even the Hrna or the Decent Work and Health Network, they will actually prepare you in terms of, you know, providing notes and points and how to go about it, and support you that way. And oftentimes, once you do it the first time, the second time, it just gets easier and easier, right? So just staying involved and then centering the voices of marginalized communities in my work has been my strength, because sometimes it may seem like you know, the person doing the work is getting the credit. I never want to make it be about me. Just like Meaghan has said, it is the communities that we serve. I was at a conference speaking last week, and a new grad nurse came to me and said, you know what, I feel motivated to use my voice, but I'm so scared. How do I go about it? And we talked about it. It's those igniting the passion and just challenging one more person, just making sure that the work is centered around the communities that we serve and not about us, has actually guided me, and just that culture of humility and staying grounded, with the work. So yeah, I don't know if I said the right things.
Well, if you didn't say the right things, that's sort of what I was going to say, actually. So then that would be two of us. I think understanding that if you're doing advocacy for yourself, if you're looking for a limelight, then you're in it for the wrong reason. The role that you have as an advocate should be in terms of helping others or supporting others to have their voices be heard. Sometimes, as a nurse, you can bring in different parts that other people may not know because you have a small piece of expertise, but in fact, I think being humble, but then also learning as much as you can, understanding that there's baby steps. We're also anxious to do everything quickly. And that over time, you may not see a change right now. 27 years ago when I started this, there were so many things to try and tackle. And there's actually, over time, there's been some movement on those. And that's good to know, but it takes other people, you get it, but not everybody does. And so it takes lots of baby steps to make change happen. And sometimes it goes backwards and sometimes it goes forwards. And you just have to be really patient and humble. Take what you've learned and try not to become exhausted. I think that's sort of all I'll say.
And you said the right thing.
Yeah, and that exhaustion is sort of where I was going to. I mean, I'm 43, I think now, and so it's like seeing those baby steps move forward, and I do see the wins, particularly probably in BC and potentially federally, changing. And as you go through your career, you'll see this happen. Baby steps forward, baby steps back. But I do take such comfort in that MLK quote around, the moral arc bends towards justice. And I do see that coming, and I take hope in that, because I think to be an activist, you ultimately have to believe in that we can make change. Like, you don't do this work unless you think you can do something about it. And harm reduction, for me, one of our core principles is love. And so I have, over the years, developed a lot of empathy for our I want to say enemies. Maybe that's a bit strong, because I see in them, and Gabor Mate taught me this, working with him, like, many of them are afraid, and it's their own addictions they're afraid of, or the loved ones. Like, some of the most challenging people I've worked with around safe supply or access to supervised consumption, when you sit and actually have a meal with them, you realize they lost someone to overdose, or and so it's like finding what are those commonalities, and they've kind of gone down this dark path towards saying, oh, well, the answer is not harm reduction. And so how do you recenter that, and just staying grounded in love, even for people that we might not agree with around our particular health issue. And of course, there are evil people, but I have been in the last few years in Sierra Leone and in the Democratic Republic of Congo and in South Sudan more recently, and been like, even in some of the most challenging settings. And the amount of collaboration I see in community is amazing. And those bad actors in those settings are not local communities. That's the impact of colonization. It's all of these horrible things happening around the world, but ultimately, that in every community I've worked in, whether it's been the downtown east side or the Congo, people are lift each other up, and I take such hope in that. And I think if you're starting out in the work and you're earlier in your career, taking breaks, because I've had to take breaks from more intense activism, because I just was burning myself out. And so I loved rest is resistance, your quote there, Birgit, because it's so important.
credit to Tricia Hershey, not mine.
Yeah, I think something that I would tell my new grad self is, Michelle, you're not always right. Like, I think that when I came in as a new grad, I had this very idealistic image, ideas of what that first place that I was working at would look like and what was right and what was wrong. And I think early on in my career, that led me to be like really confrontational about things and kind of not approach things from the perspective of genuine curiosity and trying to understand different perspectives, because I was so stuck on, you know, my way is the right way, harm reduction, like dismantle paternalistic care and, you know, patient advocacy and human rights. And I think I've learned that it's really important to listen to other people's perspectives and find out where they're coming from. And also understand that like my new grad self with not really that much experience is very different than me 15 years later. Because I've worked in different contexts, different places with different people. I was pretty nurse-centric back then. I'm still nurse-centric, but understanding that there's different people in this health and different organizations in this healthcare landscape that are all bringing something good to the table. And that, like others have said, we need to work together if anything is going to be accomplished, and not constantly think that like, you know, I'm right and, you know, I'm only going to work from a very narrow view from this perspective. Yeah, so I think that's the best advice that I would give to new grad Michelle.
Thanks,
Amazing.
Michelle. I was also insufferable as a new grad. Sorry, Corey, I just had to add that. I'm going to stop sharing.
Yeah, no, I'm really appreciative of this conversation. I'm jumping in here for the lightning round of questions, but I just wanted to add to this too, that I think in harm reduction and health justice, there is a constant state of urgency and reactivity. We are in the backdrop of colliding public health emergencies, and the people we care about are dying preventable deaths. And that sense of urgency and reactivity is often sloppy, or it makes errors down the road. And I, certainly found myself in that state of reactivity. And I think it's so important that we have to remind ourselves that sometimes we can slow the bus down to make sure that we're being collaborative, to make sure that we are being strategic, and that we're doing things in an effective and sustainable way. But we often don't feel like that's possible because of the constant state of emergency that we're in. My first question is to all of the panelists. Start with Marliss, and I'm going to actually just name people. We talked about consequences of advocacy a couple of times. I'm wondering, in the current state of things, it often feels unsafe to do advocacy, especially if it's more public-facing advocacy. How do we reduce the harms of those consequences and make it a safer place for nurses to engage in advocacy?
So for me, if I'm in a media thing, and for a lot of reasons in Alberta, that's getting harder and harder to do. But I find that if I don't speak against the government, if I speak about what we're seeing in front of us right now without making comment necessarily, but really with the idea of raising awareness of the general public, as opposed to going on the attack, it's made a big difference if I can do that. So, I'm on Twitter, and I know that's dying, but I will not often personally make comments against the government, but I will give out facts and I actually try and word them in a way that gets people thinking. So I think there are ways around it. But if I'm in the media, and because there was a question about authenticity, if I authentically say, look, I have been a nurse down here for 27 years. I have never seen it like this. I'm terrified for the people that we are lucky enough to work with. That has an impact. That's me being authentic. I'm not saying that I'm someone who uses substances. I'm not, I'm not taking on a different role. My role in that is to talk from a nurse perspective. And so when I do that and keep politics out of there, even though in my head I may have a whole lot of things going on that I would love to say, I do really try and keep it to facts and emotion, actually.
Excellent. Meaghan, same question to you.
Yeah, I mean, I really agree with you, Marliss, over the years. I mean, I sometimes during a campaign, I will be a little bit more partisan sometimes, but then I madly go and delete all the more partisan tweets that I have because people, look at them later. And I do. I think just I actually our director of communications when I was a chief of staff to a minister taught me this framing that I'll share with people. So before I do an interview, I write what I want the headline to be and what the key messages are, and I just sit with a piece of paper and I write that down, and then I write like my 3 supporting points. But the best nugget she gave me was have a do not say this box. And what are the things I don't want to say? And sometimes it's something personal, like again, talking about my son and my own history. I don't always share that. And if it was a big media, I don't want to talk about that, but like it's such a part of my story. I might, if I'm nervous, accidentally say that. So I'll put don't mention B. And what are some things I don't want to say around even like particularly like going on an attack to a particular politician, and what bait do I not want to take? Because the journalists will want to get you into a corner. And so just having some of your pivot points handy is really helpful. Because once you do go on the attack, and I think that's back to my ecosystem point, some folks can do that. Like if you're strictly in academia and you're not feeling censored, some folks can really go on the attack, but it does have consequences. It means you won't be invited back in the room when there's a big policy space. And so just understanding when you're earlier in your career, the consequences, and they can be long range. Like you can be on do not invite lists for many years. And so I didn't realize how those lists were created until I was like in that back room, but you won't get to go to those decision-making tables as much. And so just and that's amazing. Like I am always so in awe of people that are brave enough to do that, but I also strategically wonder for my current advocacy aims if it's worth it. So I try to be a little more like more neutral, but getting my advocacy points across. But if the journalist asks me to like, well, what do you think about this politician? I usually pivot away from attacking a person.
That's such an important point. I feel like sometimes, advocacy and activism, it draws people in. It's something that we can do. It feels like direct action. And so it feels fulfilling. And then all of a sudden it can become really scary. Like as soon as you start to see the comment section and you see all of that divide, that I always, going back to that question about what would you tell new grad self, is to probably be more measured in in the way that you respond and that you are fired up about certain things, because the old saying, the internet lasts forever. It absolutely is true. Birgit, I see that you have your hand up.
Yes, I'm listening and learning. It's so insightful here. I just want to start by, using Audrey Ford's quote, where she said, I write for those women who do not speak, for those who do not have a voice because they were so terrified, because we are taught to respect fear more than ourselves. We've been taught that silence would save us, but it won't. It's pretty interesting to, it's eye-opening to know that there are, do not return lists and stuff like that. But I do think that there are issues around, for me, because I'm very vocal on anti-racism because my very existence is threatened every single time I'm silent. And I remember having a conversation with a physician who said, you know, he has so much to say, but he's just careful. He doesn't want to put his job on the line. And I said, yes, right. You have to know your comfort zone. However, for me, because I've experienced the healthcare system both as a patient and as a you know, a nurse, a health worker, and I came to the conclusion that, you know, even silence will kill me. And the fact that there was no safe space, even when we speak, is just, they're only brave spaces. People were brave enough to have those conversations. It's good to use wisdom, you know, to apply wisdom. But I do think that the greatest weapon is our voice. And when we choose to, you know, not to speak because of the repercussions, it's also, we're silencing ourselves, and people just have to gauge how much risk they're willing to take. How comfortable are you not speaking? And oftentimes I find that I am so impacted by racism, for example, and not speaking is also putting myself at risk. So I could die not speaking, and I could die speaking, so I'd rather speak, right? So I think it comes from that, again, that point of privilege, and how much of it affects you, and how far you're willing to try to fight for what really matters to your very existence. So I try to balance it that way, and I pick my battles, and I know when to rest.
Well said. Thank you. I'm going to direct the next question to start with Michelle. And a couple of times the theme has come up about finding other allies. And so my question is, who is missing in the advocacy? Where are the other allies? Because oftentimes I'm finding, you know, in their current state of the workforce, that we're, you know, nurses are working short so much that we can barely staff a unit, let alone expect them to also take on advocacy. And so I'm wondering who's missing, and who do we have to pull together into this to do better work and more sustainable work in advocacy?
Yeah, I think it's super tough right now. Like, I mean, we were already short-staffed. The short-staffing thing has been going on for such a long time, but you know, in COVID, it compounded a lot of these things where we're just like, nurses are kind of like barely keeping afloat right now. And especially like I live in the Lower Mainland, so it's one of the most expensive. It is the most expensive place in Canada. So we're kind of like, a lot of nurses here are tired. And sometimes depending on where you work, like I'm very lucky that I work in Vancouver community, and am very appreciative of the fact that I am in a bubble, and a lot of harm reduction work happens here, and there's a lot of great nursing advocates in Vancouver community, mental health and substance use. But like, it can be hard to find those allies if you're working on a medical unit and you're trying to do harm reduction on like a general medical unit, and you're working with nurses that they have certain perspectives about substance use in general. So yeah, like it's a tough question. How do we find those allies? I think that's the key. That's a key question. If we can answer that, then I think we would get a lot more work done. Because I think the way that I find those allies are through things like Harm Reduction Nurses Association, and reaching out. If I read an article by a nurse and I really agree with them, and like, you know, like the research, I'll just email them. You know, like I think a lot of researchers, they're more than welcome to those types of emails, to reach out and find them, and also to look for different organizations in your area that you want to do. And it doesn't necessarily have to be a nurse, right? Like, it's just because we're nurses doesn't mean that we have to only reach out to other nurses. It can be people in other social services, peer advocacy groups. Like, just reach out to people that are like-minded, so that it doesn't feel so lonely. Because when it feels like we're the only one that in our work area that are doing this work or work a certain way, then it does, like, it really, it drains you, it silences your voice, and it makes you less likely to want to say anything. So yeah, that is my wisdom there.
And I see Marliss had your hand up and then hand down.
Yeah, I think, Michelle said what I was going to. The one group though that we have worked with here really well, and we have a really dedicated group of physicians as well. They shouldn't be left out of the mix. We have a whole bunch of brilliant practitioners and really caring people. And so many times, as say in terms of addressing healthcare issues, having this cohort of people who include other health services, including physicians. But then also our physicians are incredibly committed to not doing work without having the community there as well. Like they're very good in that perspective. So people who use drugs, there was just a discussion going on recently about how nobody should be doing a presentation without somebody, without someone who uses substances, if that's what the topic is. And that was, from the physicians. So it's finding those voices, because like it or not, a lot of people love to hear from a physician at the end of the day. And, we can all as nurses get really frustrated with that, as I am, but that's the truth. So that's all I want to say.
Very correct.
Birgit or Meaghan, do you want to add anything to this question before we move on?
I could just add my 2 cents. Marliss is actually, she's speaking the truth, right? And I've actually collaborated. I have some great physicians that I have, collaborated with. I still collaborate with on social justice matters, and we've written op-eds together. We've done work together. It's just, I feel it's just much more powerful when the physician's credentials is added to the work, or when their voice is included. So again,
Well, you've muted by accident. I can unmute you, I think. You went silent for a moment.
yeah, because a call was coming on my phone. Oh, I'm sorry. Yeah, again, it's just, the power of teamwork and, expanding our sphere of influence by collaborating with other members of the interdisciplinary team, and they're coming with their perspectives, makes our work even stronger.
Amazing. This is a question from one of our attendees. Long question. How do we organize across this country regarding harm reduction in care? Politically, nurses ought to organize now to advocate for mental health and addictions care in the coming years, as some community members look for overly simplistic solutions to addictions care. We have all seen the erroneous and dangerous political rhetoric offered by many provincial government leaders and the federal CPC leader. These political leaders are threatening to roll back hard-won advances in care, and I'm very concerned about this. Anyone is welcome to. Yeah, Meaghan.
I mean, I think I've talked a little bit about having friends across the other side of the aisle is really important. So I don't know. I mean, I think health is political, and really, so much of our access to healthcare is nested within like the political power that politicians and other governments have. And so I just encourage, if you're not already active in municipal, provincial, and federal work, and to pick an area and start to just get engaged, because that's where you'll learn a lot of grassroots organizing skills too. Again, like politicians and political campaigns really know how to organize a campaign, and we can do campaigns for harm reduction too. And so just encourage folks to add that, but to keep the door open to the other parties. So at Insight, when we do tours, we learn from the founders to always say yes to every tour. So we were, if somebody was from our opposition, we welcomed them and gave them a tour, and gave them just as much time as we would someone that was seen as more of a traditional ally, because I think Mark and Liz recognize that governments will change and that you need to kind of carry on. I mean, I lived through the Stephen Harper years, and, you know, it sounds strange, but we kind of had to go underground a bit and change the way we called things. And you just get, I mean, I was involved in the pandemic prescribing that I mentioned. As another one, word safe supply, just people weren't ready to say it. And so I remember writing, you know, some of the early bits of that guidance and calling. And the other thing is like picking up the phone and just, again, using those relationships. So I called our, you know, strong partners with people with lived experience, and called some of the biggest activist groups and said, we're going to put out this thing, and it's not going to say safe supply. And you're probably going to be frustrated, and I acknowledge that, but here's the rationale. And I just want you to know. And people had, you know, here's a draft. Do you have any input on what we are saying? Because what we were doing was really hacking the pandemic to open that window for safe supply. This was in the early days of COVID, pre-vaccine. And so we just shared the strategy with our allies, and were able to kind of explain the thinking, and then it worked. Like, we just didn't call it safe supply, and we got it through. And people didn't almost realize that we were basically providing alcohol, cigarettes, and like stimulants. We had fentanyl patches. We had like everything we'd been asking for. Just we didn't use the right word. And so I think as winds are changing, you'll just have to get creative and call things different things. That's how we survived the Harper years. I don't know, Marliss, you were there too. Anything to add?
Yeah, boy, that was the time. And it may come back. That's the scary part. And I think that the question is one that speaks to that. How do we, as a collective of nurses across the country, try and deal with this? There's sort of a level of far right politics and conversation that happens. And groups like Hrna in Alberta, we have Anchors, which is the Alberta nurses involved in harm reduction. So trying to find groups. The problem with that is finding the time to go to a meeting, trying to find the time to stay up to date on everything. It's so difficult. One of the things in the past that we've had is, for example, the stimulus conference, where a number of people came together, but I think face-to-face, trying to make gatherings where you're face-to-face with individuals, then you can see and feel passion face-to-face that you can't on a screen, or you can't over typing something out. So if there's any opportunities to try and do those things, that would be great. And I honestly have to admit, I don't know what the Canadian Nurses Association is saying about these things, but it would seem to me that they would have a role in some of this.
I think too, if I could just add to this conversation a little bit, when things break down federally, or when things start to look like big pieces look like they're starting to fall apart, it's never a bad idea to start local. There's a lot of work that can be done in local organizing, in making space for local organizations of people who use drugs, of trying to find out what you can do right there in the spot. And like one of my mentors, and Marliss is I consider her one of my mentors, but one of my mentors, Bernie Hawley, once told me when I was super frustrated during the pandemic, and with all the things that were happening, that she said, nothing you do is going to change the system overnight, but everything you do today can help the people. And that was a reminder to, like, honestly, shut up and do good work, and to try to focus on individual advocacy. Oh, if you can, whoever is on can mute, that would be great. And so, yeah, I think, organizing locally, also like seeking solidarity and having groups that you can talk to, that you can vent to about things, that you can understand like each other. I'm just going to find and mute that person. Okay. I think that should be fine. And so I want to go to our final question for today. Just trying to find it here. Okay. How do you speak authentically? And I mean this in the most gentle way possible. If you're a person who is not of that community, this question is being asked by a cis white able settler, without taking that power away from the community with whom you are trying to advocate for in their absence, e.g. in a conversation.
I think that was sort of what I was trying to get at before, which is, you know, my role should be to assist the community to have a voice that's heard, and to move forward. But there are times when I'm asked things where I identify, you know what, I'm very privileged and I've not had, you know, a lot of the same life experiences, but that's what I'm going to. But that's when I'm a nurse down here for about 30 years. And this is what I see. And this is what, you know, some things that could maybe help, or, but really not being afraid to let people know that I'm impacted as well every single day by what's going on around me. And so it's not, I'm not speaking, you know, my drug use was so long ago, honest to God, it's just pathetic. But speaking from a perspective of where I am here and now, and authentically, I cry sometimes because of people that we've lost. And I think that's as authentic as I can be.
I just wanted to add to what Molly said, and I was recently in a room with, you know, a leader, a nurse leader I, you know, respect so much, and bulk of her work is on harm reduction, and what she said, you know, was really profound. How she's constantly reminding herself that this work is not about her, but about the community she works with, and in amplifying the voices, she makes sure that she never takes any interview without having someone with a lived experience speaking. So her role is to empower them enough that they can, you know, be able to speak for themselves. And why she takes the back seat. I think that's really important because no matter how much we insert ourselves in those spaces and in such work, we can never replace lived experience. And it's really important to center the voices, like Marliss is saying, and by continuing to empower those that are, you know, directly impacted. So I do think that that's a great approach. I just also wanted to add that, you know, in the power of harnessing social media and using different platforms to reach a wide range of audiences in terms of the first question. And sometimes we don't realize that, you know, there's a huge community on social media. I've seen people organize, you know, rallies just from Twitter spaces. You're able to reach people wherever they are, even if you're having lunch or they're in their bedroom. People can tune in and listen. And so I think having people who are able to leverage, you know, such huge platforms will help to organize and mobilize more voices. Thank you.
Marliss, I see you have your hand up.
Yeah, I guess the one thing that I would say is that certainly in the world of drugs and drug policy, sometimes people can be put at great risk as well for speaking out. Suddenly they are known by police, for example, or family that didn't know maybe that they were using substances, or so I think we just also have to be really sensitive around how we facilitate that and that we don't put people in any kind of jeopardy.
Thanks for that.
And I was just going to say, like, also recognizing that sometimes you might not be the best person to speak, and it's okay to respectfully decline. You know, if someone reaches out to you to do some teaching on something that's not, you know, that would be better served by including people with lived experience. It's okay to say, like, you know, thank you for reaching out to me because of my expertise in this area, but I might not be the best person to provide this education. And then having those connections to you know, refer to someone else that might have lived experience or be of that community to provide that education.
Such a great point. We've got just a few minutes left, and so that concludes the open discussion component. I want to just leave a minute here if any of the panelists want to have a closing remark. You're welcome to do so, and then I'll just I'll say our thanks, and we can close for today. That sounds like enough silence for me to indicate that we're done for today. I want to thank everybody who attended today. Really appreciate the conversation. I hope you found it as useful and inspirational as I did. I want to give a really special shout out to all of our panelists today: Marliss Taylor, Birgit Umaigba, Meaghan Thumath, and Michelle Danda. And we'll have the recording up for this available real quick. And thank you again, and hope you have a great rest of your day.
Thank you very much.
Thank you. Bye.
Take care. Thank you.
Hi, Caroline. Caroline could have been up here doing this.
Awesome job. Thank you so much.
Birgit, I just
Yeah,
wanted to
yeah.
say that I follow you on Twitter and you're one of my heroes. So it's just really
Oh my
cool to be able to
God.
see you in person. So
Thank
thanks.
you so much. It's such an honor to be on this